Oncoplastic breast reconstruction is done when a wide lumpectomy of a tumor is done on the breast by one of the breast surgeons, and there is an anticipated large defect that is going to result, and also an asymmetry with the contralateral side. So generally what we do in those cases, we're called in to move the tissue around and then lift the breast tissue up, and then lift the other side or reduce and lift the other side to try and make them look as aesthetic as possible. The risks of the procedures, aside from the general risks of bleeding, infection, and wound complications, you can have changes or loss of sensation to the breast and or the nipple area. There is a risk of residual or recurrent deficits or defect depending upon the amount of breast tissue that's left. Basically what we're doing is dependent upon what the breast surgeon does. You can have nipple areolar complex necrosis or lack of blood supply, and this again has to do with what's being done by the breast surgeon and the tissue and the blood supply that we're being left with. If there is a concern about the nipple areolar complex blood supply at the time of the surgery, during the surgery, I will actually take the nipple areola off and graft it back on to prevent it from necrosing. But sometimes it's not apparent during surgery, and sometimes it can happen after surgery. It's very, very uncommon. But it can happen. If that happens, then we have to do nipple reconstruction or tattooing later on. There is a risk of asymmetry with the contralateral side. Sometimes, as I said, we'll reduce it beyond what is being reduced by the breast surgeon. So there's a risk you're going to end up being too small. There's a risk you're going to end up being too large. And if there's a plan for radiation on the oncoplastic side, which is very common, you can have an asymmetry after the radiation. The radiation often has a shrinking effect, but often it doesn't have a shrinking effect, and we never know if that's going to happen. So sometimes after the radiation is done, sometimes we'll have to go back in and do something to make them look more symmetric. And then lastly, as with all surgeries, there's the risk of scarring. The risk of scarring is 100%. You will have scars. The only thing I can guarantee about the scars is that you're going to have them. We're going to have you on a scar regimen afterwards to try and minimize the appearance of it. Interestingly, the radiation, if you do get radiation, has a very positive effect on the scarring. It generally helps the scars tremendously. So that side usually heals with very nice scars.